Hi, everyone. And today we will talk about qualitative research articles. So what is qualitative research? It's a broad term that means several different things, and there are several different methodologies that share many similarities. They could be explanatory, descriptive, inductive in nature. They use words and not numbers to explain a phenomenon. So, one of the things that you'll look for when you look at a qualitative research study is there may be a few numbers in it, like the sample size or the demographic distribution. But when you get to that analysis, you're going to most likely see some quotations by some of the participants, and you'll also see content analysis or thematic analysis. So what do qualitative researchers believe? They believe that reality is socially constructed and it's contextual. It's dependent on each individual's perception of their own reality. And they're trying to discover the meaning of those experiences. That's the basis for knowledge. The qualitative approach fits a research question when the researchers seek to understand the nature or the experience of a phenomenon by attending to personal accounts of those with direct experiences. Someday, one of the qualitative studies that I would like to do is how how psychological empowerment develops in nurses. And that would be done by interviews and asking people that have a high perception of psychological empowerment. What led to the increase or increased perception of empowerment? It couldn't be measured. It would have to be thematically analyzed. So the review of the literature, it should indicate if the question has been asked and answered. It should kind of give you an angle that the proposed study will focus on. It's going to, in the conclusion section or the discussion section, should show a need for new research. It should indicate what participants should be in the study sample, and it should narrow down what kinds of questions should be used to collect the data. And remember, the questions are going to be narrative. They're going to be open-ended, semi-structured, not quantifiable. So they're going to capture words and ideas of participants. The study design is how that qualitative researcher plans to go about answering the research question. The sample, just like in quantitative studies, is the group of people that the researcher will interview or observe to collect the data. The setting is where the participants are recruited from or where the data are collected. Data collection strategies differ significantly. As I already mentioned, quantitative, we use numbers, we quantify ideas. This time we want to collect words, and a lot of times they're done in semi-structured interviews that are recorded and then transcribed. And then the researchers will look through those transcripts looking for some themes, some recurring themes. How were the data analyzed? How was it handled? The next one is findings. What are the results? What are the themes or the general ideas that the researchers discovered as they analyzed the data, as they progressed through that thematic analysis of data? And then finally, the discussion of the results and the implications for any evidence-based practice. Remember that evidence-based practice also has that component of how likely that individual would be to comply with that treatment or that treatment regimen, or how likely an employee, a nurse, would also be likely to comply with that treatment regimen. So we have to take into account those social phenomena to apply it to evidence-based practice. So we need to understand the experiences of our patients. Everyone experiences things differently. So this gives us some insight, some empathy. It can assess status or progress. It can provide anticipatory guidance and coaching. We don't test intervention. We're merely seeking to understand patients' experiences. It might provide information necessary to pursue some quantitative studies, and sometimes the qualitative studies will precede the quantitative studies. And it could be used for theory development or the extension of some type of a theory. So that's chapter 5 in a nutshell. Moving on to chapter 6. This is just a nice graphic from your textbook, and how qualitative research methods are used and by whom. So there are several different types of qualitative research methods. The first one, and probably the one that you'll find most often in your literature search, is the phenomenological method. It's the process of learning and constructing the meaning of human experience. And this is usually done through extensive, intensive interviews with people who have lived through the experience or that are currently living through the experience. Again, you want to look, as you read through these qualitative articles, you want to look at the research question from the researcher's perspective, and then see whether that sample selection makes sense with that research question. As the researchers gather data, usually pretty early on, they're going to reach data saturation. And that just merely means that they'll generally start with one participant and do that intensive dialogue, that intensive interview with the participant. Then they will transcribe the recording, look for themes in that transcript. Then they'll proceed to the next participant and do the same thing. And then they're going to compare and contrast the two different transcripts to look for recurring themes. As new themes emerge, they continue to recruit another participant, and they're going to recruit until no new themes emerge. When no new themes emerge, that means that there is data saturation. Typically, they will interview a few more just to make sure that they know that there are no new themes emerging. All right, so I think I've already covered this. Data analysis, they generate themes from those transcripts. Then they'll go and describe the findings. They use detailed descriptive language. Usually it's described as thick, rich descriptions as they develop these themes. And we'll move on to grounded theory. Grounded theory shows us how things develop. It's an inductive approach with the aim to arrive at a theory about some social processes. I mentioned earlier in this lecture that I want to do a grounded theory study, a qualitative grounded theory study on how empowerment develops among nurses. So I've already identified the phenomenon, which is psychological empowerment. I've already structured my research question, and as I will have to identify nurses who have a high degree of perceived psychological empowerment. And that's how I would go about selecting my study participants. And the data are gathered in the same method. Interviews are conducted, probably a semi-structured interview. Those interviews are recorded, and then they would need to be transcribed. And grounded theory also is looking for themes among the data. Typically, qualitative researchers simultaneously collect data and analyze it, just as I explained for the phenomenological method. We do theoretical sampling. Now, remember from our quantitative lectures and readings in the book, probability sampling is how that's done to get a good sample, to get a representative sample. However, in my example, I will want to look for those individuals who have a high perceived psychological empowerment. So I'm in theory going out to those nurses who perceive a high degree of psychological empowerment because I want to know how that developed in their practice. From there, I can do snowball sampling. So I can ask that participant if they know of any other participants with that quality, a high perception of psychological empowerment. They do open coding, looking for themes in the data, and they do the constant comparative method, comparing the coded data with new data. Finally, they describe the data and in detail and allow the readers to follow the process. And at the end of that grounded theory process, typically there would be a graphic of how the data emerged. So in my example, there might be some kind of a circle or an arrow progressing through different stages of empowerment to get to that high perception. But I haven't done the research yet, so I don't know what type of a graphic that might be. In the next qualitative method is ethnographic, and this focuses on a scientific description and an interpretation of a cultural or a social group or social system. So a good example would be the researcher is going to maybe a different culture, maybe a tribe in a secluded tribe in another country. They would need to, that would be an ethnographic method. Now that's a little bit far-fetched for healthcare, but that gives you like the flavor of how to study that. Maybe you're a med-surg nurse and you want to do a study on intensive care nurses. So that would be a different social group. So that's an example there. Again, structuring the research question from the researcher's perspective and then selecting your sample. You would do data gathering. You could do this in interviews, just like the other two methods. You'd also do observation and interpretation. So a lot of times these ethnographic researchers will also keep a journal or field notes, and they would refer to the field notes as well as with their observations as well as the information gathered through their interviews. This is probably not a type of research that you're going to use for your EBP papers. I'm really not going to go into it anymore. The case study method, and this isn't like a case study where a patient has some very rare disease and like a healthcare provider would explain about their journey through. The case study method studies the peculiarities and the commonalities of a specific case to explore research questions. First, they would identify a phenomenon, a specific case bound by space and time and place. So sorry. So you could think about how nurses adapted during the COVID pandemic, and that would be a case study method type of study. And again, I don't expect that you use a case study method in your critique as you're gathering your literature. In the case of case study research, the researcher would also do interviews, do field observation, do document reviews. So in the example I cited, how nurses cope during the COVID pandemic, they could look at the different iterations of infection control practices just to see how that evolved, but document reviews and any other methods that would contribute to the evidence for describing that phenomenon. And these are some other ones. I don't expect you to find community-based participatory research. You may find some mixed method research out there. Mixed method is a report that uses both quantitative and qualitative data in one cohesive study. And it combines the stories with numbers, and it provides the most complete picture of that phenomenon. These are a little bit more difficult to critique. I really don't want you to critique a mixed methods research study. These are some types of secondary research. So as a reminder, secondary research is research by an individual or a group of individuals that did not perform the research themselves. What they're doing is they're going out, they're doing a literature search, finding a group of similar articles, and then they're aggregating them and then providing thematic summaries. A meta summary is a quantitatively oriented. A meta synthesis is qualitatively oriented. So some issues in qualitative research, you just to keep in the back of your mind, ethics are the data gathered in a naturalistic setting? How did that design emerge? What is the extent of researcher and participant interactions? Is the researcher an instrument, or are they also part of the study? And you'll want to look at rigor and data integrity in the qualitative research. That wraps up chapter 6 in a nutshell. Now we're going to just leap right into chapter 7. For the purposes of your group qualitative article critique, these are questions that you're going to want to keep in the back of your mind as you read through and then critique your qualitative research article. So, qualitative research is a basic level of inquiry that seeks to discover and understand concepts, phenomenon, or cultures. It's used to develop a theory or to discover knowledge about a phenomenon. And the findings are presented in a narrative format. Contrast that with a quantitative research, which presents findings in a quantitative format, numbers, tables, statistics. And then they use the raw data, usually quotes from the participants that identify that theme, that kind of exemplify the theme that the researcher discovered. Remember the purpose of qualitative research: to describe or to understand phenomenon that are important to nursing, and these can contribute to evidence-based practice. Does the abstract provide a clear overview of the research? In the introduction, the focus of the study should be apparent, and the rationale for the format, the type of qualitative study. How did the researchers select the sample? And if you select a grounded theory, the literature may be one form of data collection. There should be some philosophical underpinnings. Study of humans is deeply rooted in descriptive modes of science. And there should be a close relationship between data collection and data analysis. As I mentioned earlier in this presentation, oftentimes the researchers will collect data from one participant, transcribe the interview, and then analyze for themes before they go and collect data from the second and subsequent participants. So the aim is discovering the process at work in that area of study. Is the purpose evident as you're reading through that article? Were there ethical considerations taken into account? How did they handle sensitive information? Did they use purposive sampling? Were they selected because of their life experience? Did snowball sampling happen? Did data collection happen until data saturation was reached? Could that explain the number of participants throughout the study? Is the way that the researcher handled the data clear so that you as the reader could understand why a particular strategy was selected? How did they analyze data? How did they transform the raw data, the transcripts from those interviews, into the common themes that were identified? These are important because anytime you read a research study, qualitative or quantitative, those researchers should give you the recipe as to how to replicate their research. Did this qualitative study do that for you? Other things to keep in mind are authenticity and trustworthiness. We want to make sure that the study is authentic. Did these quotes actually come from participants? Can we trust that the researchers did a good job at translating what they heard and interpreted to be true to that participant? And then finally, findings from that qualitative study should be discussed in a narrative format that tells the story of that particular experience.